My name is Anna Sadovnikova. I am a board-certified lactation consultant. I'm also an MD, PhD candidate studying mammary gland biology and breastfeeding medicine at UC Davis in California. And I do have a conflict of interest to disclose. I'm the CEO and president of LiquidGoldConcept. At LiquidGoldConcept, we are singularly focused on improving breastfeeding outcomes and maternal-child care through healthcare professional education. The vast majority of women in the United States and globally are unable to reach their breastfeeding goals, predisposing them and their infants to completely preventable disease and death. One of the main reasons for suboptimal breastfeeding rates is the inadequate training of healthcare professionals in clinical lactation and maternal-child care. In the image you see on the slide, a group of trainees is crowding one patient's bed, which means that probably just one or two of them are going to actually get active learning experiences from this patient-provider interaction. Academic institutions have recognized that their learners need more active learning experiences, and so they've pivoted to simulation-based training, using everything from mannequins and dolls all the way to the gold standard, which is the standardized patient actor. It's an individual who is trained to portray a patient based on a case scenario and script. They respond the same way, they interact with the learner in the same way, and then, best of all, they are trained to provide feedback. And this is the most important part. The feedback that the standardized patient educator provides to the learners on their communication and interpersonal skills is where the learning happens. At LiquidGoldConcept, we are pioneers and emerging leaders in simulation-based training and clinical lactation. In 2017, we commercialized our first product, the wearable breast model that is manufactured in 4 skin tones. It lactates and gorges, is compatible with a breast pump. Different conditions are depicted on top of it, like mastitis or milk blebs. And really, this product is meant for comprehensive training of healthcare professionals and even mothers in prenatal and postpartum classes in breastfeeding management. We expanded our scope in 2019 to include various breast health conditions from psoriasis on the areola all the way to drug reactions and breast cancer. And we were just awarded in July of 2020 an SBIR Phase 1 award from the National Institutes of Health. And for this award, we will be developing a newborn simulator that is realistic in look and feel and has a programmable jaw to simulate diverse suckling patterns. And we really thought that this would be our crowning achievement, this in-person simulation portfolio. But of course, with COVID-19, we realized that the majority of in-person education quickly faded away as academic institutions scrambled to develop virtual and safe learning opportunities. We realized that we needed to support the healthcare professional training needs during and following the COVID-19 pandemic. And so in June of 2020, we launched the on-demand telesimulation platform for maternal-child care training. This is the world's first online platform where healthcare professionals and trainees can schedule an on-demand video call with an actor or standardized patient educator who has been trained by us and our amazing group of content experts in how to portray a breastfeeding patient. And then the learner, this healthcare professional, can engage with the actor over video call in a case scenario relevant to peripartum care. As you can see in the photo, the actors are wearing our breast models. These breast models match the actor's skin tone. And so it really creates this realistic experience for the learner where they can truly practice not just general clinical skills like how to obtain a history and perform a breast assessment, but also kind of more focused lactation skills, like how do you teach someone how to do hand expression of breast milk or massage their breast for engorgement alleviation, and eventually position and attach a newborn at the breast over a video call in this telehealth setting. So now I'm going to switch gears a little bit and talk about the development and validation of this platform as a plug-and-play solution for healthcare professional training in maternal child care. We partnered with Dr. Liv Anderson over at the University of Michigan School of Public Health. We actually got a grant from the Association of Teachers of Maternal and Child Health to develop our inaugural set of cases under the umbrella course Lactation Support in a Telehealth Setting. And as you can see, these cases cover a broad range of topics from pediatrics and clinical lactation all the way to breast cancer and general breast health and maternal mental health. We brought on a very strong team of experts with a range of experience across breastfeeding medicine, pediatrics, obstetrics, and dermatology. And just to give you an example of how we would develop one case, we of course first would set up the learning objectives and the general kind of patient story. What would the learner have in that confirmation email after they schedule the video call? What information would they know? They see the learning objectives and then the fact that this patient is calling for a telehealth visit, her milk just came in, and her son is fussy at the breast. And then what we would do is start to create these self-directed learning modules, essentially multiple choice questions to help prepare the learners to successfully complete the telesimulation. And we wrote multiple choice questions very similar to kind of board exam preparation questions with detailed explanations for each multiple choice answer. And we went through multiple rounds of validation and until we reached consensus with our expert team. And then in parallel, we actually recruited and trained 12 actors. Each actor received a script. We went through the case scenario, taught them about the emotional tone, had sessions on how to provide feedback, and then the actor completed 2 practice sessions with our content experts and 1 practice session with a novice learner, someone who's just starting on their pathway to being a clinician. And this approach and the validation and our findings are all going to be published open access. We have a manuscript under review right now. Just to give you a sense of the functionality of the platform, so we mentioned that we can do on-demand scheduling of a video call, but really the kind of cherry on top of this whole experience is the fact that all the learning for the healthcare professional happens when they receive feedback. And there's actually 2 opportunities for feedback, the first being a formative assessment, where the standardized patient provides feedback to them on their soft skills, like interprofessional communication and clinical skills. We have this validated rubric that we're using with 6 items that span kind of a variety of different things from empathy all the way to just being organized in the encounter. And then we also have case-specific items. There's 4 per case that are directly linked to the learning objectives for the case. And these I know statements serve as a proxy for the standardized patient self-efficacy and breastfeeding skills. And so for a learner to receive a score of 6 for something like I know how to perform reverse pressure softening, it would really mean that the learner kind of went above and beyond, really came prepared, was able to teach the standardized patient and then have the patient teach back to the learner how to perform this really important technique for the alleviation of breast engorgement. So that's the formative assessment rubric. We also developed a summative assessment rubric. So after the learner completes the telesimulated encounter, they go back to our platform and they fill out essentially a patient note, like a SOAP note or encounter documentation. It has multiple items on it, everything from just summarize the encounter, list the main concerns, elaborate on them by highlighting elements of the patient's history and physical assessment, and discuss the management plan that you propose to the patient. And then we have our clinicians who come in and use this rubric, and again, this is just an excerpt of the rubric, to grade it based on whether or not it's complete and concise. So in summary, what we developed is one platform where learners can prepare for a telesimulated encounter by completing unfolding case scenarios with multiple choice questions. They then schedule that encounter over a video call at whatever time works for them. Then they engage with our actor who is wearing our realistic breast model. The actor provides them feedback, verbal and written, on their soft skills like communication. Then they complete an encounter documentation that's written, and they receive written feedback from a physician-trained lactation consultant on their clinical performance. Next, I'm going to go through a series of studies, whether completed, ongoing, or planned, where we attempt to understand how telesimulated encounters affect learning and patient outcomes. So first I'm going to talk about our feasibility pilot study at Michigan State University where we incorporated telesimulations into the breastfeeding medicine elective, with the primary research question being how does this telesimulated experience affect medical students' performance of clinical skills relevant to lactation support? This was completed in May of 2020. And essentially, after the learners completed the telesimulated encounter, got all the feedback, we asked 2 questions about satisfaction and did a focus group as well. And what we found is that over time, the students' confidence and competence and just general clinical skills increased, no matter what case content they started with. As they became more familiar with the platform and knew what to expect, the fact that the SP is wearing a realistic breast model, their general kind of overarching score improved over time. So we thought that that was really interesting and an important caveat to note as more institutions transition to these telesimulations. We also saw that learners are very satisfied with the experience and were very engaged in the content, with one learner noting that this telesimulation experience was better than any other simulation experience they've had thus far in medical school. The manuscript where we present all of these findings and the methodology is currently under review and will also be published open access. Next, we have a couple of studies that are ongoing, in progress, where we are taking it kind of to the next level to understand whether or not these telesimulated encounters lead to the translation of skills to telehealth and in-person settings. We have 2 ongoing studies. One is at UC Davis with physician residents. We have randomized them to complete either the intervention or the treatment arm, which is the telesimulation about breast engorgement. And then the control group is a case-based discussion over a video call. And the lead investigator there is Dr. Adrian Hoyt-Austin, who is a pediatric fellow. Another study that we have is at Johns Hopkins School of Nursing, led by Turner Wiley, who's a doctoral candidate, and her advisor is Dr. Debbie Bush, who's our longstanding collaborator over at Johns Hopkins. And what Debbie and Turner are doing is running kind of a cohort of nursing staff in the mother-baby unit through our breast engorgement telesimulation, and then they're looking at translation of skills to patient care a month later. So in general, the study design for both of these studies is to collect data on demographics, self-efficacy, and their kind of historical practice patterns before the telesimulation, have everyone go through the telesimulation unless they're, of course, in the control group, and then we measure satisfaction, their self-efficacy with clinical lactation immediately after, and then a month later, after they've had exposure to patients, we collect self-efficacy again, practice patterns, and even schedule a semi-structured phone interview to gain deeper insight into why, how, when did they translate skills relevant to lactation support to the care of patients in phone, video, and in-person settings. So to give you a sense of what that practice pattern survey looks like, on a scale of 0 to 10, they have to mark or indicate how many times in the last month they've completed the following tasks. And these tasks, the first 5, are linked directly to our learning objectives for the telesimulation, with 2 items, numbers 6 and 7, being control items. A couple other studies we have ongoing or planned are related to team-based learning and telesimulation. So up until this point, I've been talking about one-on-one telesimulation with 1 learner and 1 actor, but our platform actually has the capability to schedule 3 learners simultaneously, which is really great for programs that have learners spread out across the United States and really need a solution for easy scheduling. And we have 3 studies with our partners at Michigan State University, where we're going to be randomizing students to a 1-on-1 or a 3-to-1 telesimulation and measuring satisfaction, self-efficacy, and clinical competence. We have a randomized controlled trial planned with the Pathway to Lactation Consultant Training Program, and then we did submit a maternal telehealth access grant to look at the effect of telesimulations at the ability of WIC staff to translate the skills that they learned in the telesimulated encounter to the care of pregnant and lactating WIC participants. And then kind of long term, so 2021, I mentioned that we were awarded an SBIR Phase 1 award to develop this newborn simulator. And again, with our partners at Johns Hopkins, we'll be testing the effect of telesimulation with a newborn simulator and our breast model on the learner's ability to acquire skills relevant to newborn positioning and attachment in a telehealth setting. The strengths of our approach are pretty clear. I mean, the ability for students to be able to deliberately and repetitively practice general clinical skills relevant to maternal-child care and lactation with a live human. The ability for students to schedule these sessions on demand, and then of course for students to be able to join with their peers or even colleagues from different clinical backgrounds in a team-based telesimulation. All of these things are definite strengths of the platform. Of course, the most important limitations of the platform are the fact that there's a cost associated with simulation-based training and that not everyone has access to high-speed internet. But moving forward, our long-term vision is to ensure that every single healthcare professional and trainee has access to immersive learning experiences in maternal-child care. And we're very grateful to all of the organizations that have funded and supported our work over the last year. And of course, anyone who is interested in our work and our platform and wants to collaborate is welcome to reach out directly to me. My contact information is on the slide. Thank you so much.